One of the expected and horrific side effects of this pandemic and the pandemic-driven recession is the loss of health insurance as people lose their jobs. A new study estimates that more than 5 million American workers, I don't know what the average household is these days, they say it's 4 people. That's 20 million American people lost their insurance this spring, a number that's higher than those in any full year of insurance losses. And that's just this spring, 3 months. 5 million American workers because they lost their jobs. Can you, I don't know where you are on this. Health insurance, unless SAG-AFTRA union goes bankrupt, and I don't foresee that they will, this is one thing, out of 10 million, one thing I don't have to worry about is health insurance. That's because, it's not because, way to think ahead, Malloy. Way to plan your life, Malloy. No bullshit. It's because it was there. It's because as a member of SAG-AFTRA, it was there for me if I wanted it, and I took it. And now that I'm officially retired from SAG-AFTRA, the insurance will continue. I still have to pay for it, but it will continue. Now, maybe you have that kind of an arrangement. If you do, then like me, you're one of the fortunate in this country. But there are millions of us, tens of millions of us, who have to rely on having a job in order to get health insurance, which to me is madness. What kind of sense is that? But that's how the capitalist system is set up. All the so-called social democrats or democratic socialists who have been pushing for single payer, and some who are not democratic socialists but are just simply liberals or on the center left of the political spectrum, have been saying over and over and over again, we have to have single payer, government financed health insurance. Government finance. Oh my God. Oh no. That's communism. Shut up. Sit down. Stick something in your mouth to suck on and forget about it. No, it isn't. According to the New York Times, this pandemic has stripped an estimated 5.5 million American workers of their health insurance between February and May. And again, that's a period of time in which more adults became uninsured because of job losses than have ever lost coverage in an entire year. That's according to the latest numbers on this. The study was announced today, Tuesday, by the nonpartisan consumer advocacy group Families USA. Oh, boy, does that sound communistic, huh? Families USA? Watch out, man. Assholes. But Families USA, one of the good organizations out there, good advocacy groups, they're not advocating for more guns and bullets and death and destruction and Bibles and shit. They're advocating for families. Yeah, even Christian families, believe it or not. But they found that the estimated increase in uninsured workers from February to May was nearly 40% higher than the previous highest increase. And that occurred during the Great Recession of 2008 and 2009, when 3.9 million adults lost their insurance. We are working through 5.4 million who have lost health insurance. Stan Dorn, who directs Families USA's National Center for Coverage Innovation, and he's the one that wrote the study, he is quoted in the New York Times as saying, quote, "We knew these numbers would be big. This is the worst economic downturn since World War II. It dwarfs the Great Recession of 2008. So it's not surprising that we would also see the worst increase in the uninsured, end quote. Now, this organization, Families USA, is one of a number of groups that are trying to estimate the number of people who've lost insurance during the pandemic. And it will always only be an estimation based on the best information available, the best numbers available. Definitive data on this, according to the New York Times, will not become available until mid to late 2021. What's mid to late? August to November? Over a year from now. That's when the federal government publishes health insurance estimates for this year, 2020. So it's always like a year behind. These various analyses that are coming into play here will vary, but all reach the same grim conclusion, and that is simply that more people lost insurance in that 4-month period, February, March, April, May, than ever before. The nonpartisan Kaiser Family Foundation has estimated that, in fact, 27 million Americans have lost coverage in the pandemic. 27 million. Now, the 4 million, or the 5.4 million, that's just for the first 4 months, or February, March, April, May of this year. But the study by the Kaiser Family Foundation took into account family members of the uninsured. So what did I say a minute ago, 20 million? The Kaiser Family Foundation says no, it's more like 27 million. And another analysis that was published yesterday by the Urban Institute and the Robert Wood Johnson Foundation projected that by the end of this year, at the end of 2020, more than 10 million people will no longer have employer-sponsored health insurance or coverage that was tied to a job they lost because of the pandemic. What are we going to do? What are we going to do? And yes, I say we. What are we Americans going to do to help the 20, 30, 40 million people who are having their health insurance ripped from them through no fault of their own, through piss-poor leadership, political leadership from this orange ape in the White House, and filthy, rotten, predatory capitalism that has been gutting people's health care for the past 50 years. What can we do about it, Truth Seeker? And I ask the question seriously. What can we do about this? Surely there is something. Of course there is. But as long as some of these self-styled Christian right-wing semi-fascist capitalist pigs are running everything, it will not happen. Just like Pastor, what's his name? Hagee, that rotund lump of poison. In his sermons, I remember a couple of years ago, I saw one of his sermons. If they don't work, let them starve. What a good Christian attitude, huh? Oh, and he commands all kinds of respect from all kinds of white people. Oh, maybe some black people too, I don't know. But when are we going to make this stop? You know, we can make this stop very quickly, relatively speaking. But as long as the country is run by and governed by, or I should say governed by and controlled by what are predominantly white, male, Christian, neo-fascist thugs, it will never happen. And then these people losing coverage could then face staggering costs. How are they going to pay for it if they do contract COVID-19, which has sent, you've seen on television, seriously ill people into hospital ICUs for weeks, sometimes months. What is the average cost of an ICU? $6,000, $7,000 a day? $10,000 a day? $20,000 a day? Thank God for the technology, but dear God in heaven, 20 grand a day? How are people going to pay for it? Now, these studies by the Kaiser Family Foundation and by Families USA and other nonpartisan groups, they come in the thick of this campaign season. And in particular, thanks to the orange, gruesome goddamn ape in the White House, the future of the Affordable Care Act, Obamacare, is going to be a major issue in the campaign. Why? Because the fascist right-wing Christians want to kill it. Because Obamacare does really evil shit like insist, until the Supreme Court ruled the other day, that insurance companies provide pregnancy control pills in the insurance plans that are offered to, oh, help us, oh, please, Mary, I'm going to faint, Christian-owned businesses. Oh my goodness, we have to do that. We have to provide substances so that our female employees can go out and screw and not get pregnant. Oh, no, Jesus never wanted that. You sick bastards. Democrats and Biden want to expand the Affordable Care Act. And Trump, this filthy, evil son of a bitch, this orange ape, is trying to get, as he would put it, his Supreme Court to overturn it. Do you know how many people would be without coverage? Another 25 million or more. This is what Trump is trying to do. Why does anyone who is sane even consider a vote for the orange ape when he is trying to kill them? Jesus. 4 of every 5 people who have lost employer-provided health insurance during this pandemic are eligible for free coverage through expanded Medicaid programs or government-subsidized private insurance through the Obama health care law. Do you hear me? 4 of every 5 people. And that's what Trump is trying to kill. And experts are now saying that ensuring the recently unemployed is a difficult challenge. I hope to shout. Many people can't afford premiums for coverage through either the health care law or the program known as COBRA. And other people might not know that they are eligible for Medicaid. And then you have the states run by these filthy, rotten, right-wing Christian Republican males who didn't want the expansion of Medicare into their precious state. So now what? Hi, Truth Seekers. Mike Malloy here. As you know, we've switched formats and are now broadcast exclusively on the Progressive Voices Network. So that means you get fewer program interruptions, no corporate commercials, and lots of profanity. But our format change also means some of our radio listeners no longer hear the program. It's been a while since I mentioned our podcasts, so you may have forgotten that there is a way to listen to this program anytime you need a good dose of screaming. Visit MikeMalloy.com and subscribe to our podcasts. You have your choice. You can listen to the ranting with the audio podcast or listen and watch me lose control with a video podcast subscription. As a podcast subscriber, you can download the program to your mobile device and take me with you wherever you go. And if you have a friend who needs a dose of truth-seeking, you can give a gift subscription as well. That's MikeMalloy.com, and never miss a minute of the uncensored fun and frivolity.